My final guest today is going to be Dawn O'Connell, Assistant Secretary for Preparedness and Response at the Department of Health and Human Services. She's the agency's principal advisor on public health emergencies, and her office leads the nation in preventing and responding to and recovering from adverse health effects of man-made and naturally occurring disasters. Welcome, Dawn, to the program.
Bob, thanks so much. I'm so pleased to be here with you.
Well, Dawn, based upon your responsibilities at HHS, you've had a real interesting last couple of years. Can you tell us about specifically with antibiotics and what HHS is doing? I know there's a lot of public-private partnerships, but how does the HHS, which has been the forefront for COVID, deal with this issue?
Well, one of the things I've learned in the role that I'm currently in is I haven't had the luxury to focus only on the acute response that we're currently helping to coordinate and execute against, which is COVID. We also have teams that have not taken their eye off the ball for some of these other really concerning and worrying potential issues, some real, some around the corner. So we do have teams that have been focused on antimicrobial resistance through the course of even COVID, which has been a really good thing. And across the department, we've had a lot of efforts over the last decade in something. There was an initiative called Combating Antimicrobial Resistant Bacteria, and it was launched in 2014, and it's existed and sort of been honed in over the last two administrations since then, which is a whole of government effort focusing on slowing the emergence of resistant bacteria. That's something CDC is really involved in. Strengthening national One Health surveillance, that's seeing where the animal populations might be showing some resistance. That's a USDA function. Advancing the development of tests and diagnostics, the therapeutics and vaccines, all of those pieces, and then making sure there's a global health piece, since so much of this is going to be experienced worldwide. So just to say, all of HHS is engaged in this effort. The piece that I'm most responsible for in the role that I'm currently in is the development of future antibiotics that can be used and brought to market quickly. I have something in my office called the Biomedical Advanced Research Authority, or BARDA. And BARDA realized over a decade ago, about the same time that the CARB initiative was being launched across government, that when it comes to responding to public health emergencies, having antibiotics is critical, maybe sometimes as a first-line response, as we saw with Cipro in the anthrax attacks, and sometimes as a second-line response, as a reaction to something that's occurred in a public health emergency. And the BARDA team was looking across the pipeline you've heard a lot about today, and seeing that it was drying up. And what BARDA's bread and butter is, what it does for the federal government, is it takes those things that companies don't find are marketable, don't find worth investing in, but are great ideas, and pulls them through the advanced research and development pipeline. So it often starts with biotechs who are very innovative, as you know, and are generating ideas, brings them through phase 1, phase 2, and into phase 3 and FDA approval processes. So BARDA pulls these critical components through that companies don't want to spend the money to invest in to get all the way to the finished product. So antibiotics, of course, is one of those things that BARDA's been focused on now for several years. Over the course of that, we've seen 3 to market, and we currently are invested in 18 additional products. And that's all through our advanced research and development. But over the course of this, what we realized was we were missing some of the innovation at the beginning, and we needed an accelerator. We needed an accelerator to come through and bring things along a little faster so we could start pulling them through phase 2 and phase 3. So in 2016, BARDA, along with NIH and the Wellcome Trust, launched something called the CARB-X Accelerator, and that has since brought and focused on over 100 different antibiotic products to try to launch and bring in through this innovative phase that the BARDAs of the world and other advanced research and development entities could pull through to market. So we're very pleased with that effort and continue to stay focused on trying to look for more products that we can help and support. The other piece we found that needs a little bit of help, and I think this was referred to in a previous question, is what happens when you go to market and nobody wants to buy it, no one wants to invest in it. And so we've committed to something called 4 by 30, which is we would procure 4 new antibiotics by 2030 to be able to have on hand to respond to public health emergencies. And that would at least give 4 additional antibiotics the opportunity to get post-market procurement and post-market success.
We have a reader question for you. It comes from Christine Guaco-Pabia, Chief Medical Officer at Nebriva Therapeutics. And her question is, what steps are the relevant government agencies taking to support companies that are currently developing or waiting FDA approval of novel antibiotics?
So this is one of the places where BARDA plays, and this is, the piece that I'm responsible for, which is helping to make sure they can get through that phase 3, ramp up manufacturing, and then get the authorization and approval paperwork, data, all of that collected, packaged, and submitted to FDA. You also heard me say this is a cross HHS effort. So while those are the pieces that BARDA does to help bring these companies through, NIH plays a role, of course, in early clinical work and support, and FDA is waiting on the other side of this to receive these data packets. So there is an awful lot of support and interest in HHS for this work.
Your office is responsible for maintaining the strategic national stockpile. What is the status of the stockpile today?
Well, the stockpile, it's certainly gotten a lot of attention over these last 2 years, as it should. Its bread and butter, of course, is maintaining and providing medical countermeasures for public health emergencies. And we're, seeing some of the work it's able to do right now with the monkeypox outbreaks we're all reading about. And it does support and hold some antibiotics. We don't talk about those publicly for obvious national security reasons, but we certainly do have some on in stock and will continue to do so.
What about, what has HHS learned regarding COVID-19? And, as you know, in Washington, agencies go about their business and appropriations kind of goes up a little bit each year. But obviously now we've had a pandemic and health experts now, many of them are calling for, hey, we've got to invest way more up front so we can save on the back end.
Well, I think that's absolutely right. And we certainly saw some of the benefits of that, quick investment when we got those vaccines for COVID in under a year. That was remarkable, and it was a whole of government effort. BARDA was pleased to be a significant part of that. And we've learned that lesson. We've done that now, and we know how to apply that moving forward. We're continuing to look at pandemic preparedness. There was a request in the president's FY23 budget for $88 billion to invest in future pandemic preparedness and to take those lessons, that manufacturing development, that quick process, and apply it to additional viral families. So we will continue to exercise that muscle and not lose the advantages and the strengths we've gained in this last very, very long and continuing response.
The response to in dealing with antibiotics, I mean, this whole issue, looking at the stats, and it's kind of grim. What advice do you have for people, whether they're patients or providers, in helping put the attention on this issue, which obviously has not gotten the attention it deserves?
Well, let me thank you all for doing this forum, because it does need attention, and it warrants attention. It's one of the most terrifying things we think about when you look across. If we lost antibiotics, if they all became resistant to one thing or another, we would lose the ability to do chemotherapy, the ability to do some of these complex surgeries. We've come so far in medicine, so it's really important that we continue to invest in the antibiotic pipeline. And one of the things that CDC has been doing is issuing guidances and recommendations for healthcare providers on when and how to prescribe antibiotics. When is it appropriate? When is it not appropriate? And I think patients play a role in that too. Is it an earache? And will an earache respond to antibiotics? Is it viral rather than bacterial? All of those questions need to be asked as we carefully look at preserving the current capacity we have. And then hopefully the work that BARDA and others are doing will continue to bring more antibiotics onto the market. But that's a slow process. So we really do need to save and preserve the capacity we currently have.
Dawn O'Connell, thank you so much for joining us today.
My pleasure. Thanks so much for having me.
Well, that brings us to the end of our program. A big thank you to the Pew Charitable Trust for their support, and to all of you attendees for joining us for this discussion. For those who may have missed any of the conversations, video from the event will be up on our website, thehill.com, shortly. I'm Bob Cusack. Be well.